Hello and good morning, everyone. We're going to get started in a few minutes. People are trickling in. We expect a big crowd today. See a lot of familiar faces. So just wanted to say hello and make sure you all could hear us.
Good morning, everyone. I want to thank you for joining us today. This is our first forum of this type, so fingers crossed it goes well. We are psyched to see all of you here today. I'm Jen O'Connor. I'm Director of Policy and Advocacy at Prevent Child Abuse New York. I'm also the Director of the New York State Home Visiting Coordination Initiative, which we will talk a little bit more about a little later in our program. But I want to introduce a couple of other folks. Maggie Dixon, who's with Bikini and the HVCI, is going to be doing tech for us today. She is also recording this forum and will capture the chat so that you will have a transcript of the chat after the fact. And we'll be doing a really quick survey to get your feedback again after this wraps today. We're really excited to have everybody here. We had about 350 people register today. We've got over 100. People are still filtering in. So that tells me that this is a timely webinar and people have a lot to say and to share. And so we're hoping that we can really have a nice dialogue as we move through the next hour or so. I'm going to turn this over to Erica LaValle, who can introduce herself and we'll get us started. Thanks again for being here.
Hi, everyone. My name is Erica LaValle, and I am the Director of Training here at PCANI, and I oversee the coordination of the training for Healthy Families New York Home Visiting Program. We provide the core training and ongoing professional development and quality assurance for the sites throughout New York State. So it's great to be here today. I think what we wanted to do is just sort of get the pulse of how people are feeling today. So if you'd like to, I think we can see on the screen, Maggie has given us a link and our QR code so that you can give us a word about how you're feeling today. And we're going to populate a nice little word cloud for us to see how folks are doing out there. So if you could just take one word and describe how you're feeling today, enter it. Maggie will share our results.
I will go ahead and share the screen with the results, and folks can just head to www.menti.com and put this code number in there or scan the QR code with your phone if that's easier. And I'm going to go ahead and jump over to the live presentation so folks can see the word cloud populating.
386115.
All right. So we see in the chat that there may be people who have gotten we're at capacity. We're going to try to see if we can troubleshoot that, as we expected about 350 today. So we'll see if that may or may not be able to be troubleshot while we are on.
Unfortunately, it looks like we've set the Zoom link up on the account that only has the max capacity of 100, but the good news is this session is being recorded, and I'm sure it's not the last of these forums. So hopefully folks who are unable to join today will have the opportunity in the next coming months. So we do apologize for that tech mishap. We're 3 years into the pandemic, and I guess still having these issues with Zoom. So we appreciate your patience, and I'm sorry for that.
No problem. It just tells me that people are really interested, and we will we'll get them in there. And I'm excited to see these. These are much more positive words than I anticipated, frankly.
Hopeful, happy, positive. We had some sleepy and some overwhelmed and some drained. So a little bit of shared feelings there.
Also in the chat, we've got some folks just chatting in their feelings. We have overwhelmed, stressed, feeling great, positive.
Resilient. Productive. Good. Nice. All right. So what we'll do is, again, we're happy to see how you guys are all feeling today, and we feel similarly as we are in our first spring, right? Spring is just around the corner, but then winter comes back, and then spring will come, and then winter will come back. So we are all hopeful for sunnier days and bright sunshine. So I'm glad to see that a lot of you are so optimistic. We also, again, we expected to have a lot of folks here from across the state.
I am always early. I was signed.
Lots of different places. So what we'd like you to do is we'd like you to sort of indicate for us where you are from regionally. And these are the list of the program areas that are in our backbone organizations. So if you could just select the one that you are in.
Poll is launched, and we've got results still trickling in, so I'll go ahead and share those when we have a high response rate. 75 people. Answers are still coming in. Give it another couple seconds.
It's a good mix regionally.
Right, we see that some people are co-located in multiple, so if you just choose one, it just gives us a good read.
All right, so it's been about a minute. I'm gonna go ahead and share those results. Are you able to see the spread here?
We can see that there are people from all over. We've got some folks in Western New York, looks like a little bit more in Southern Tier, a little bit more in Central, and then in the Capital Region. And it looks like Mid-Hudson is maybe one of the largest groups that's with us today, 22%. Great. Well, wonderful. Thank you so much for sharing. So what we'd like to do now is we'd like to ask, as we again have mixed registration as far as who wanted to take part in our outreach engagement and enhancing relationships webinar today, These are the programs that are associated with home visiting in New York State. And so there are many listed here that you may be a part of. However, there may be an other. So we know that there may be people who are not from home visiting programs. So what we'd like you to do is we'd like you to participate in another poll that you'll select the program that you're with. And if you are not with a program, if you could just click other, and then in the chat box, if you could share with us what brings you here today, that will help us to see who's on board with us. Some WIC, okay. Early intervention. There's some review panels, early intervention, community health workers. Wonderful. It looks like our largest percentage of home visiting is from the Healthy Families New York program that's with us today. So I do see some familiar names. Great. So what we're hoping, again, one of the reasons why we wanted to do this webinar is we know that maybe many people are challenged with the same types of issues relative to bringing people to our door. So being able to do some outreach, engagement, get people that are able to be enrolled in our programs, and then keep them in our programs. And now that we're 2 years into this pandemic, really trying to cross-pollinate with each other today, where you may be finding some successes in outreach, engagement, bringing people to the door, trying to find these creative ways in order to increase our capacity throughout New York State with home visiting. So we'd like to thank you so much again ahead of time. We're going to be walking through some questions, and we're going to be asking for folks that have joined us today to share some of the things that have worked for you, and potentially be able to give people on this webinar today and those that will listen to it later the opportunity to learn new ways of doing things, and that have been successful maybe in different parts of the state or based on populations that you serve. So we'd like to start with asking some questions around those successes.
Yeah, so our first question, and we'd like you to put your answer in the chat, is how have you been enrolling new families throughout the last couple of years? You know, has that changed because of the pandemic? How are you, what are your outreach efforts, and what do those look like? And then if you can raise your hand, we're going to choose 3 or 4 folks to actually speak and talk about creative approaches that you have had to engaging new families and recruiting them and bringing them in to your program. So if you can put your answer in the chat, and then if you're interested in sharing your recruitment effort, please raise your hand and we'll just call on the first couple of folks.
So drive-through baby shower, virtual parent group events and offering baby essential gift bags, offering hybrid models so that some in person and some virtual, gift card incentives, setting up a table outside community health centers. So that's good to hear that people are still able to do some of the things that we used to do pre-pandemic, if outside and socially distanced. Okay.
I see it firsthand, so I'm going to call on Liz Rojas. We can unmute Liz.
Hi, good morning. So one thing that we've been trying to do in our program is trying to connect with actually different programs and get involved so we can refer participants from one program to the other and kind of help each other out and build that community those resources for the participant. I also just wanted to add in one thing. I have a colleague who's supposed to join in, but it says that the meeting is at capacity. Is there any way we can let her in?
So we apologize. I think that was my snafu. Again, 2 years into the pandemic, we still haven't completely mastered Zoom. So we have multiple Zoom accounts, and this one is smaller than the capacity that we actually have. So we're capped at about 100 now. We'll be recording the session, Liz, so your colleague can jump on that way. And I think we'll probably do another one of these in a week or so, and make sure that we have a larger capacity so that we can include more people. Apologies for that. And thank you for sharing.
Are there any other hands around sharing something that you've been doing that are successes with reaching new families in your communities?
I can share.
Okay.
Hi, I'm Rebecca, and I'm from Mohawk Valley Community Action Agency in Utica, New York. And we've tried a couple of approaches. We actually hired a communication specialist, and she goes out into the community and just does everything recruiting for us. She goes to events, she brings flyers, she goes to all of our local resources, and she's been a really huge asset to our program. We also came up with the idea of giving away, if you will, like a toy bundle. So age appropriate toys to each family, which each home visitor went and delivered to their families. And then those are, supplies and things that the families can use during our Zoom visits. For the older children, we give away little boxes that are filled with art supplies and paper, and just so we still had that homeschool connection with them, even though we were on Zoom for such a long time.
That's great.
Yeah, thank you for sharing that. That's great. I love the idea of hiring a communications specialist. I'm not sure every program would have the means to do that, but I think that having someone dedicated to do that work is important if you can do it.
Yes, it definitely helped because, we're all responsible in our agency for recruiting. But when this hit and, everything just went sideways, and we all know how busy everybody is, we sometimes don't get that time just to go out and see everybody in the community and to do the recruiting.
Mm-hmm. Yeah, very cool. Thank you.
You're welcome.
Yeah, and we see there's a lot in the chat. And again, we invite you to, if you didn't want to raise your hand, we invite you to put in anything that you're doing creatively to engage families, because we will be capturing this chat and sharing it with folks, especially for those that will watch it after. We'll send out the link to watch it, as well as access the notes of all the ideas that people shared. I see that there are doing virtual meetings and helping people apply for SNAP via the phone, re-engaging the referral sources that you currently are using to help grow your referrals with them. Education materials, so similar to what you shared, Rebecca, around toy bundles. Some people are putting together, it looks like, some education materials. The Help Me Grow line. Erin down in Ulster, been doing a lot of outside socially distanced meet and greets so that they can meet folks face to face. And it looks like a welcome gift and various baby items and a handwritten card to the family. So that's very nice. Any other folks that would want to share by raising your hand, things that you have found to work in your community?
Hi. So what we have been working on is the group events. And as we're attending the group events, we try to get the whole team involved in that group event so that the families can build a relationship, not only with their family worker, but with everyone in the entire team, which is from the program manager to the supervisor to the specialist. So that's been working really well. And when we do drop-offs, we have done drop-offs where we all go together, the 4 or 5 of us, where we're out there to meet that one family. So they get the opportunity to meet each other, to meet us specifically, so that, let's say, if their worker is not available, so we are all there to pick up and move, and continue that relationship and that bond. So that's been working for us pretty well.
Great, thanks, Nancy. It looks like Rebecca will take one more. Rebecca, if you'd like to unmute.
Oh, I'm sorry.
Oh, there you are.
She's done.
Yeah, sorry, I had to take a quick phone call. I'm good. I just had raised that from when I spoke before, so let me just put that down.
Okay, wonderful. All right. So speaking of referral sources and thinking about reconnecting or connecting with folks, what is your primary source for referrals or your screens? Where do you get that from? We're going to launch a poll. And so we've put a couple of choices that are sort of your usual suspects, but then we're going to also have an other category. So if it's not a healthcare provider, OBGYN, pediatrician clinic, if it's not social services with local DSS, if it's not word of mouth or a community event, what other sources or what other places might you be getting referrals from? And if you wanted to just hit other and put in the chat, if you have anything other than those. So the results are coming in. We're at a little more than half of you selecting your primary referral source. About 75% of you have participated. Can we share that screen with folks?
Yep, we're sharing now.
Wonderful. So as suspected, healthcare, number one, social services, word of mouth, and community events. It's interesting we put them in that order.
I know, right?
And then it looks like about 9 of you put in other. Is there anything you could write in the chat, or if you'd like to raise your hand, if there's an other that you'd like to share with the group? So in-home providers, Hope's Door, DV shelter, okay. Any other referral sources or screens that you're getting from other places as a result of the pandemic? So maybe you weren't receiving screens from a certain place before, but now because you've expanded through virtual networking, are there people coming from different places now? What's the donation grants? Okay. Well, and thank you very much for sharing. And again, I think it just kind of helps us to see, and, you know, with all programming, really looking at where are we getting our referrals from? Where are we getting our screens from? Is that lower than normal? What are some things that we need to think about in increasing that number? It looks like some folks were sharing that they were reconnecting with referral sources. As we know, this is a time where people may be leaving positions or positions may be changing. So there may be new folks that need to relearn about your program or what you do or your population that you serve. And so thinking about the percentage that you're getting, and do we need to increase that? Do we need to do some re-education? Or do we need to look at our return on investment and thinking about looking for alternative referral sources, because you may not be getting as much as you would need to get to your capacity. So looking at other places to get those referrals and screens from.
So now that we know where you're getting your referrals from, and what innovative ways you're utilizing to bring people into the program, we're curious as to how you're keeping folks in the program, especially over obviously the last couple of years. We know it's been incredibly challenging, and maybe some folks have either you kept them in the program throughout the pandemic, or they joined the program during the pandemic. And so how are you keeping them now as we kind of transition into in-person visits and that sort of thing? So if you can put into the chat, you know, how are you keeping people? How are you retaining people? And then if you'd like to share, again, raise your hand and we'll call on a couple of people to dialogue about this. We're very curious about retention rates here at this point.
So when we couldn't be in person, we did drop-offs, program materials, crafts, activities that could be done over a video visit or their own if they'd like, Zoom visits. So it looks like folks are using Zoom with families. It looks like milestone incentives as well, Jen, yearly events, monthly activities, offering those Zoom visits.
I'm wondering too about Zoom because I know, it took me a minute 2 years ago to get used to Zoom and having all of our meetings like that. So I'm curious if people can stick in the chat too. If you had any challenges getting families to embrace Zoom and how you worked with them to kind of make that your mode of communication.
So Andre sharing flexible time and virtual visits, FaceTime, Google Duo, calling the family and asking for their needs, sending materials, incentives, food cards. Are folks using alternative virtual to Zoom and Google and FaceTime? I know that when we were canvassing folks early on in the pandemic, people were using WhatsApp and maybe some other methods. What are folks using other than Zoom that seems to be working pretty well for you and your families?
I'm wondering too about social media. Have you increased your presence on platforms like Facebook to keep families, both recruiting families and retaining them, just raising awareness about your program?
Mm-hmm. Yeah, it looks like so. Monthly virtual play groups, doing a craft, Doxy.me, Google Meets. Some families did not have internet. We did hear that, so that you would be doing the phone visits, not necessarily the video visits. Facebook Messenger for families with only Wi-Fi, so
Yeah, makes sense.
not using free data.
Does anyone want to chime in and share? It's okay if you don't, but if you want to, just raise your hand.
Virtual field trips, increased use of our social media. Rebecca, would you mind talking a little bit about the virtual field trip? Would you mind sharing that?
Not at all. So what some of the home visitors here have done is we've looked into different field trips. We basically it was simple. We just Googled them and we would Google like San Diego Zoo or we'd Google a farm. And then we were able to pull that up during our Zoom and share that with the family.
That's great.
That's fantastic. I know my own family did a lot of virtual trips to the Bronx Zoo, so that makes a lot of sense.
Mm-hmm.
That's great.
Any others wanted to share how that virtual platform looks like? There's a lot of different things, but a lot of similarities in what you're using. Anyone in particular that seems to be working best for families in them keeping their visits? As far as the virtual platform goes, they are able to just pop into their virtual meeting with you.
Or any challenges you've experienced, something that you thought was a brilliant idea that just didn't take off, would be helpful to know too. And Allie?
And then Jessica.
Let's do Allie and then Jessica.
Hi, I'm from Healthy Families to Ben, and I wanted to share something that we had done kind of in the beginning of COVID to keep our families engaged and to show them that we're still here even though we couldn't be in person. And one of the things that we did that we kind of got some really good feedback on was we created a video. Once it was just like a mental health video for mental health awareness with all of our faces with hearts. Another time it was a message to our families. We all held like a sign and we would drop it and the next person would pretend to catch something and bring it down. And it was just like a, we're still here for you and we're doing our best. And we shared those on YouTube and on Facebook, and we got a lot of good response from our families and also from other programs that were like, oh, we could do that too. So I thought that was kind of a fun thing. I think we all enjoyed it as well in our site to kind of do that. And we're talking about doing it again, even though we can be in person now, just as another way to kind of connect to those families.
Mm-hmm.
I love that. Thank you.
Thanks, Allie. Yeah, it was I know we were able to showcase that with your permission on one of our workshops at the Healthy Families America conference, and it set to music and just real fun. So thanks for sharing that.
Jessica?
So I just wanted to share that we have a Parent Child Plus program in Westchester. And actually, once we moved to Zoom during the pandemic, we found that our attendance was even better than when we were in person. And we also found that parents were more engaged. It's often something we struggle with is engaging parents. They kind of want to turn their kids over to us, but instead, because of Zoom, parents were more engaged and more observant of the visits, which has been a wonderful side effect. And we plan, we're going to be in person in the fall, but we plan to keep a hybrid model so that we can offer Zoom visits when people are sick.
Mm-hmm. Yeah, that makes a lot of sense. Yeah, I think there are a number of us probably here in this room who've always kind of wondered about, the home visit being outside the home and the versatility and the flexibility that, that the pandemic has forced upon us, right? I'm also curious about, as we've talked about keeping parents and families engaged, how have you kept staff engaged? I'm assuming that people, like all of us, had a hard time just being isolated and being on virtual meetings all the time. Any tips or tricks that folks found? Andre, go right ahead.
Well, one of the things I think we did overall was that we gave flexibility to staff. And so we allowed them to have, self-reflection days. And we do a lot in parent-child around self-reflection and how you're doing and how you're feeling. You're only as good as you are when you're bringing your services, with the families. The other thing I wanted to mention and follow up with Jessica, what Jessica was saying too as well, we also continue to meet the families, even though in the virtual space, we did a lot of drop-offs with our materials, which are primarily books, in the languages of those particular families. So meeting them in their cultural space, with their culture, particularly not only during the pandemic, but also talking about racial equity and how do we meet them culturally and linguistically to keep them engaged with their families. So we still brought the materials in the languages that most of Parent Child Plus early learning specialists work with.
Great, thank you.
And there's a lot of great stuff I'm seeing in the Zoom as well. Monthly story time Zooms, reading a story weekly for children, mental health counseling, and dance. Looking at some of the folks who are story night, read the book and do the activity that goes with it. And also weekly lunches, so people could stop in and chat with each other on Zoom. Also sending note cards and fun goodies through the mail. So that's great. Yeah. Anyone want to share a little bit about the story time and how that looks as far as inviting people to it and how you facilitate, and what does that look like interaction? Is it one way, you reading to them, or is there opportunities to interact back? I don't know if Andre's hand is still raised or if
He's done.
Okay. Does anyone want to talk a little bit about their monthly story time or their reading stories or recording those on the YouTube?
I can talk about my story time, my story night.
Great, wonderful.
Okay, I do it once a month and I go along with the classroom theme. So, let's say it's the beginning of the year and we usually do the kissing hand. So we read the story, we do the project, that goes along with the story. It's usually over Zoom. And it gives the parents time and gets them kindergarten readiness because they have to do their homework with their children. So that goes along with kindergarten readiness. It gives a chance for the parents and children to get to bond. And it's for the whole family. It's not just our Head Start child. So if they have a sibling and they want to sit down, the sibling can also be there. And my parents enjoy it. I've been doing this for maybe about 10 years now, close to it. And it seems to work for my center and our organization.
It's great.
Great idea.
So I'm looking also, in addition to weekly lunches, it looks like virtual coffee and tea time on Wednesdays, and continue to do that. And then emailing games. What do you do? Memes, so games that people can interact with each other. And it looks like someone, Rebecca, also shared about hiring a mental health consultant, so that they could Zoom with staff and with families.
Yeah.
So that's great.
Yeah, and it seems like there was a lot of, we've heard this previously, that because of the need to be more flexible, there may have actually been more contact with families during the pandemic, and it might just be a text, 5 minutes on a Tuesday, but people were connecting in those different ways and able to do that, and so they were able to continue to really strengthen their relationships with their home visitor.
Mm-hmm. And two, I think what we're seeing, at least in Healthy Families, is that the way supervision is, has really been infused even more so with reflection, like Andre had shared, really being able to check in with people. How are you doing? Taking a breathing break, really being able to, as you shared, you have to take care of yourself before you're able to kind of help others. And so being able to invest in that reflective practice and checking in. So it looks like folks are really embracing that. Do most of you find, I guess you could just by show of reaction, that folks are checking in more frequently with staff? And for the most part, do you feel people are doing pretty well as a result?
Yeah, if you can just give a thumbs up or a smiley face or something like that, I'd love to know how that's working out.
Staff were more productive, being flexible, working from home. Had an LCSW come to the agency. Looks like every Tuesday, 6 children together via Zoom, and win raffle for their participation. And then Thursday is Dance with Nelson.
I want to meet Nelson. That's great. I'm wondering too, as we transition, hopefully maybe out of this pandemic, how many of your programs are going to continue a hybrid model? Now that you found that it has, been relatively successful, it seems to be something certainly we've heard anecdotally that families want and need. So is that something that you will be continuing to pursue? I think one of the reasons that I ask is, as we talk to the state about continued funding for home visiting and federal MCV funding for home visiting, we're looking at what restrictions apply to programs in terms of getting together in person or not. And so I certainly just think personally that hybrid works and allows for flexibility for families. So I'd love to know if people are going to continue to keep that model.
And there was a question earlier on that makes sense to insert now, is how are people doing, maybe some virtual and some out in the field, actually in the homes with folks, around the vaccination, around what things are in place to make sure that that is continuing, and people are looking to see how many people are able to get out there and do it not virtually, and how that works. So Parent Child Plus will continue to do both. Hybrid works well for families. It increases your home visit completion rate, utilization. So again, being able to make visits happen. And some of you, I guess maybe by show of hands, if you could, in the reaction, thumbs up if this is also true, you know, just thinking about, you have some families who've never had anything but virtual because we've now gone 2 years. So you may have families who've never been able to experience an in-home visit if you're not yet fully doing in-home visits. So pre-pandemic, they may not know what that really looks like, what your program looked like before. So just curious, you know, how you see those families obviously maybe benefiting from a little bit of a hybrid model because they can still do what they've done virtual, but then also get to meet all of your beautiful faces actually in person the way it was intended. Anything anyone would like to sort of add around embracing that in-home visit or seeing people in person? So it looks like Allie just did my first home visit with a family who never had one. Child's almost 1 and she loved having it in the home. And wearing masks, staying socially distant during the visit, and then assessing the comfort levels of the family.
Yeah. Great, that's fantastic. I want to thank you all. This is, you know, it's, again, we're adapting too, right? So we're reading these chats. And like I said earlier, we're going to save the chat and you'll have the transcript. So there's some really good ideas here that are popping up. I'm going to give folks one last, as we're just kind of watching time, one last opportunity if anyone wants to share anything orally, just, you know, raise your hand and we'll let you talk. We'd love to hear some voices.
Yeah, I'd love to hear from some of the programs directly about what you're doing and the successes you've had. To now remain in the home throughout the pandemic, utilize virtual visits, having the option to do virtual based on the family prefers beneficial for the family. Aaron, also more families are preferring in-home visits, having the option to do virtual.
Well, I love that you're responding to, obviously we know that home visitors do this all the time, but I love that you're responding to what the family needs and what the family wants, so what their preference is. That's fantastic. Thank you very much for weighing in on this. I'm going to talk just a little bit about the home visiting coordination initiative, because one of the things that we're hoping to do with this webinar is to make greater connections. So we're hoping to connect some people on this webinar to each other so that you can continue to share your stories, your challenges, and your creative ideas. We're also hoping to connect you to the larger universe. And so a little bit of background on the New York State Home Visiting Coordination Initiative. We started a couple of years ago with the intent to, again, connect the different models to each other. So more of a coordination between healthy families, nurse-family partnership, parent-child plus, the community health workers, and so on and so forth, but also to connect home visiting programs to other early childhood initiatives. So one of our big pushes has been connecting home visiting and childcare, specifically home-based childcare. And so that's an ongoing project. We also, like I said, have 11 regions, and each of those regions has a backbone organization. I saw on here a couple of our backbone organizations represented. Thank you guys for being here. Each of these backbone organizations convenes a regional team in each of the 11 regions. If you are not part of one of those regional teams, we want you to be. So if you can put some information in the chat or email us afterwards. I think Maggie can put her email in the chat. You can email, I'm throwing Maggie in there. You can email Maggie directly, and we will connect you to the regional team in your area. There is strength in numbers. We are finding as this initiative progresses, just a real strengthening of kind of that 0 to 8 world. And so we want home visitors to be connected again to each other, but also to different programs like childcare, like WIC, like SNAP, like mental health services. One of the things that the HVCI does is Maggie runs a monthly webinar series. So like this, we generally have an expert or a program that we want to highlight join us. Next up will be Reach Out and Read. They'll be sharing their information on our next HVCI webinar, but we have done some on domestic violence, handling families who are in a domestic violence situation. We have had some on self-care. We have had some on diversity and inclusion. We've just had a really great webinar series over the last couple of years, and you can find those webinars, the recordings of those webinars on our website, which we will share as well. I can't see that.
So Maggie put her email as well as the New York State Home Visiting Coordination, where you can find all the recordings.
Thank you. Erica is my eyes at the moment because I can't see anything. So, so if you can check out the website, you will see links to each of the programs that are currently active in New York State, and you'll be able to find some information on the backbone organization in your area as well. We would love to have you at the table. You should have noticed on our slide presentation some kind of cute characters. Those are from an adaptation of the Talk, Read, Sing national campaign. We have adapted that campaign to be home visiting specific, and we're launching that again at the regional level. Each region is using certain materials in the way that they see fit, whatever works best for their community, to help get the word out about home visiting and to hopefully increase referrals. I was really excited and a little surprised, honestly, to see that most of the referrals, according to the information you gave us, came from healthcare providers, because we've heard the exact opposite in a number of our meetings with folks, that their OBGYN never mentioned that there was a program in their area that they might be eligible for and they should connect to. One of the flyers that we have put together is specifically for healthcare providers, and not just for the physician, but for the front office staff, the nurses, the physician's assistants, the clinicians, so that they can understand why it would be important to refer a family to home visiting, and to connect them to those services and supports if they are available in their area. So again, something that if you connect with your regional team, that PR campaign will be rolling out this spring in each region, and you'll have access to all of those materials. But we're excited about that possibility of just raising awareness and getting more referrals to programs.
Right, and knowing that they're universal around home visiting, and that it's the common message to bring people to anyone's door. And we know that there are deserts in New York State where there are currently no home visiting programs. And so most of the programs in New York State are not at 100 or more % capacity. And so we know that there are room in our programs to have more families. So again, if you're connected with the backbone organization, if you're connected with the HVCI, if you go onto that website, you can have access to these materials. So again, it's this common marketing theme. And when connecting with the BBOs or the regional meetings that happen right now virtually, being able to share, again, ideas around if one program is not necessarily the right fit, that the person or the family could come to one that fits best. And so really being able to coordinate those efforts. So we're hoping that just having this webinar today will at least just start the conversation, because it is an ongoing conversation, but start the conversation of more combined efforts in finding places on our program rosters for families to reap the benefits of all that we have to offer. Really just trying to think about, again, being able to extend this to multiple programs and multiple people. And I know there are a lot of questions. Some people were able to get on towards the end because our capacity was 100, but some people had to leave, and so it let people in. This will be recorded. You will be able to watch it. You will be able to get a full transcript of all of the chat based on the questions we asked today, so that you can revisit some of the ideas that people shared and hopefully add to your program. But we will probably need to explore putting another one on the calendar, very similarly structured to today. And then we'll use the larger Zoom account to be able to allow folks to go in. So if you'd like to partake again, or if you wanted to let folks know that weren't able to get in today, we'll be sending out information around how to join the next one. Because again, I think outreach and engagement, retention, and enhancing the relationships is, you know, an ongoing conversation that you could never learn enough about from others.
Yeah, and you know, our intent in doing this webinar today was really twofold. We wanted you guys to know that we hear you and we see you, and we want to offer as much support as we possibly can and connect you to each other so that you have a support system. We also very selfishly rely on you to tell us what's happening out in the field and what needs to change. And so everything you have told us today goes, you know, into our notes and into the conversations that we have at the state level. I can tell you that one thing that we are pursuing is legislation around universally offered home visiting. We are very interested in, like Erica said, the capacity of the existing programs. We just don't have enough programs in enough places. And if we could destigmatize home visiting and allow a couple of light touch visits for every new parent, new family in the state, and then refer them and build up, shore up the existing programs so that there are more and capacity is greater, that is our end goal. And so all that you tell us today and on, you know, in future conversations helps to inform our conversations with legislators and with the governor's office and with state agencies to tell them this is what we need. This is what we're hearing from the people who are doing the work. So this has been invaluable for us. Again, my apologies for being just still not technically able to schedule a Zoom, but I have other strengths, I hope. So we will ask for you to tell your friends and neighbors if they didn't get in today, they'll get into the next one, absolutely. I'm going to put Maggie in charge of scheduling it. And I think we have one more activity before we go.
And I just want to sum up that the recording will be accessible on the Home Visit Coordination Initiative webpage. We will be sending a note to everyone that was registered today with a link to that webinar, as well as with the notes or where to access the notes that we took from today. And then we'll be sending out more information later about the next offering. So we'll also be sending you a link to a survey, just a few short questions around your experience today, how helpful it was. If you have another topic, or even if you have a program that you'd like to highlight, you can get in touch with us. You'll be able to write that on the survey so that maybe if you wanted to be involved in a future webinar, we'd love to explore possibilities.
Yeah, we'd love to know in this survey that you get, and it will be no more than 5 really quick questions. Do you have ideas for additional topics? Because again, we want to be responsive to your needs. So we would love to hear ideas that you have for future webinars.
And we'll be sending that out after the close of today's webinar. So look for that in your mailbox in a few days. And again, thank you so much for being here. Would love to sort of get the pulse of how people are feeling. If you would want to take part in what you took part in at the beginning, and use the website or the scan on your phone QR code, just let us know how you're feeling. So maybe a word to describe now that we've come to the close of an hour together. How are you feeling? And then Maggie will, when it gets populated, the word cloud will pop that back up so people can see. Any other outline questions? Anything anyone wanted to insert before we sign off for today?
I love that the word proud popped up, because I was thinking that too. Like, you should all be really proud of yourselves. I mean, this has been an unprecedented global pandemic, right? And I think everyone just really rose to the challenge. So thank you for the work that you do.
Hungry.
Yes.
I
We're
concur.
hungry. Lauren, did you have something that you wanted to say?
Yeah, I just had a question about the flyers that you were talking about that HFNY did. We like them a lot, and I put it in the chat, but I don't know if it's possible to format them in a way where we can put our local contact information on them.
Yes.
Because there really isn't a specific place that makes it look decent at the same time.
Yeah, great question. And we can send out information on how to personalize, but the front of each flyer is standard, and we ask that you don't, well, I don't think you can touch the front. The back is completely adaptable. So that's where we expect folks to put their local information. And as long as you can type into a Word doc, that shouldn't be a problem.
And if I could just add quickly, Lauren, I'm going to go ahead and stop sharing, and I have our email contact information on the last slide here. You can go ahead and shoot me an email and I can send you instructions. We're kind of relying on our backbone organizations to relay the instructions to input on the templates on the back, but you can shoot me an email at mdixon@preventchildabusennewyork.org and I can send you the instructions from our graphic designer on how to edit the PDF template. And also I just wanted to add a quick plug. I know folks were putting in their chat. I'll be sure to save the chat. There's a list of email addresses, but just to make it easier, if you could just send me an email directly to be added instead of me trying to write down all of your email addresses and sending you emails after today's session, that would be great, but I'll do my best to try to save my chat and go back through.
Wonderful.
Thank you all. Yeah, I hope we were at least a little helpful to folks. We are looking forward to continuing this dialogue. Like I said, we can't do the work that we do at the state level without all of you. And so, bear with us. We'll have another one of these in a week or two. And we will look to you for ideas, and we'll come back to you with questions as we kind of transition back into real life again.
Wonderful. Well, thanks everyone. Have a wonderful day. Enjoy your lunch, and we'll talk with you really soon. Thanks so much.
Thank you.
Thank you.